news release from the California Department of Public Health about counties that are struggling with some of the metrics. The information that came from the state that said that based on the given rate of disease transmission in some counties and the need to reduce non-essential gatherings where disease is increasing, CDPH has recommended that all counties that are on their monitoring list for more than 3 consecutive days, but less than 14, were recommended to close down bars, and any any county that had been on the list for greater than 14 consecutive days are required to immediately close bars within the county. That information was released yesterday around noon. We are still awaiting further guidance from the state. This morning we have started to put together a list of facilities in the county that we believe meet that requirement. We will be sending out notification to those facilities asking for them to comply. We've asked for a call with the state today to gain further information about how the state will enforce and how their order will be released. We're still awaiting that further guidance, but we wanted to make sure that we provided the public with the most up-to-date information as it stands today. We expect some more information that we will receive, and we will be releasing that as soon as we obtain it. With that, I'm going to turn it back over to Megan.
Thanks, Matt. Just a quick update on our testing. We have over 14,000 tests completed at our state and county sites. We are seeing a positive trend, higher usage in all of our sites, so we're excited to report that. We do want to let people know that over the holiday, the hours will change. We did have some sites change their hours, and we're collecting those now, and we'll update our website soon. Again, you can find all of that information at kerncounty.com. There's a COVID-19 testing button right on the front page, and we suggest you contact them before you head over between now and the holiday. Now I'll turn it over to our Chief Administrative Officer, Ryan Alsop.
Thanks, Megan. Good morning, everybody. We continue to ramp up testing here in the county with over 60,000 Kern County residents tested for COVID-19. Over 55,000, or about 91% of all of those who have been tested, have been negative. We are seeking the results of about 691, or about 1% of the total number that has been tested. And today, 4,548 residents, or 8% of the total tested, have tested positive. Today, of the 4,558 residents who've tested positive for COVID-19, 4,398, or about 97%, are either fully recovered or are isolated and recovering at home, treating their symptoms on their own. 83 residents, or 2%, of those who've tested positive are receiving some sort of care in an area hospital, and unfortunately we've had 68 deaths of those who have tested positive. We currently have 810 available regular hospital beds throughout Kern County and 66 available ICU beds. The Kern Recovers loan program, to date, just some updates on this program. $11 million in funding has been allocated out to Kern County small businesses, 423 businesses to be exact, representing businesses from across 161 different industries. The average loan is a little bit over $25,000, and it's taking from time of application to the time of funding about 15 days. Again, if you are a small business in Kern County, you can get information on this forgivable loan program at kerncounty.com. Later this week, we'll also be announcing a program for PPE, personal protective equipment distribution, for Kern County small businesses. Again, we're targeting about 5,000 independent small businesses throughout the county for this program. Information on that program will be out on kerncounty.com in the coming days, and we are looking at a July 1st launch date for that program. Finally, on the governor's metrics and how counties are being monitored, last press conference I began reporting on those numbers. It's really across three main areas having to do with testing positivity rate, case rate per 100,000 over a 14-day period, and the percentage change in the 3-day average of hospitalized patients. On the testing positivity rate today, we are just over 6% on testing positivity rate. The state's goal is for counties to be below 8%, so we are achieving that goal today. The case rate per 100,000 over a 14-day period today in Kern County is 86.49. The goal is less than 100. Today, Kern County is in compliance with that state parameter. Thirdly, the percentage change in the 3-day average of hospitalized patients. Today in Kern County, we are at 13.68%. The state's goal is for counties to be below 10%. We are today exceeding that state goal, and today that exceedance of that state goal keeps us on the state's watch list. And with that, happy to answer any questions that you may have.
Thank you, Ryan. We will go through the same process we always do. We have a number of outlets on the line. Remember, *6 to unmute, and we will go in order. It looks like the first 3 are not online today, so I'm going to go through them really quickly just to make sure that we don't miss them. KUZZ, the Bakersfield Californian, and Kern Radio. Okay, Channel 23, anyone on the line with questions?
Yeah, hi, good morning, Brian.
Brian,
Hello, can you guys hear me?
yeah, we just lost your audio for a second. Go ahead.
Oh, no worries. Okay, can you hear me now?
Yep, go ahead.
Okay, awesome. So I know Matt Constantine noted that there were some facilities you guys have noted that would fall under the governor's order to close. How many facilities have you guys projected so far? Also, I was just kind of wondering, being on this, monitor list and now being prompted to close down, Ryan, I know you've been pretty outspoken about, folks making poor hygienic choices, which is really the biggest factor in them contracting COVID-19. Do you, not as a result as, businesses reopening, do you think that for Kern County, this is kind of unprecedented that bars are closing down, given that we haven't heard anything from our own public health department about, there being a bunch of cases at these bars, hence why they haven't been prompted to close down?
We'll have Matt respond first.
So I'm going to try to remember all your questions there. The first part of your question was the number of facilities. We've tentatively identified about 70 bars that we think meet the state's requirement to close completely. There are hundreds others, more than hundreds likely, where the bars within a restaurant would need to limit their services. It gets pretty specific on the types of services that are limited, but they are trying to discourage people becoming in close contact with each other, and as opposed to a sit-down kind of restaurant where you could order alcohol with your meal. So we are using the original guidance document that came out a month or so ago that limited bars' ability to be open. We're going to use that as the document until we hear further from the state. I think your second part of your question was how you haven't heard from public health in reference to outbreaks. I think you mentioned to bars. So that is true. As Kim Hernandez has told us each week, we see most of our cases as it relates to close personal or household contacts of cases. And although there's been some attention nationwide about different types of businesses being focal points for outbreaks, locally, we have not seen that in bars. So we're anxious to talk more to the state. The document that has been released by the state gives you some of the premise that they've used on why they've chosen bars, from people coming together. It's a social event where you have your masks off because you're drinking. You're in close contact with others that are likely not part of your personal household contacts. So we believe those are the reasons, but we're going to ask for more clarification. Did I answer all of your questions?
Yeah, Matt, thank you. Yes, you did.
Thank you, Ryan. Our next.
I'm sorry, I was just wondering if Ryan had any comments on just on that. If not, I also just wanted to ask Ryan, does this affect the way business loans are looked at? I know part of the process that some of these businesses that have been closed for so long have to write how they've been affected and the time frame that they've been out of business. What does this then do to those business loans? Are they able to then readjust what they've submitted, ask for more money?
We'll have Ryan try and respond to that. Ryan.
Okay, thank you.
Yeah, I mean, obviously, establishments like bars are eligible for loans. We have provided funding through our program to many bars, and I guess the answer to your question is that we will need to be flexible and fluid in our decision making as it relates to how we continue to deal with COVID, the decisions that are being made by the state with regard to closures like bars, and assessing how we may help these facilities more long term, given what's just happened. These are all things that we're going to have to be thinking about. The one takeaway on all this is that the state Sunday came out due to our county continuing to be placed on this watch list. I mentioned hospitalization rates, which we have said time and time again at the end of the day is our biggest concern here in Kern County. And all the things that we've been talking about, the guidance, the best practices, the hygiene practices that you mentioned earlier, all these are part of managing that particular issue to make sure that our hospitals are not overloaded, overwhelmed, making sure that we don't have to set up a field hospital. These are our big concerns. This is what this is all about, and we need to be aware that if the state is taking action here, Matt outlined some reasons why they're targeting bars. It's an indication that there is potential there for other businesses in other industries to be pulled back. So again, the takeaway here is we need to be vigilant. We need to continue to practice all the things that we've been talking about, that the state's been talking about, that the federal public health officials have been talking about all along. Continue to use good practices, because we want our economy to remain open. We want as many businesses in Kern County to remain open, operating under guidance safely for their employees and their patrons. We want to continue that activity. The way we continue that activity is to make sure that we're all playing a part in managing this virus as it's here.
Ryan and Matt, thank you.
Our next outlet is Kern Soul. Anyone on the line?
Hi, good morning. This is Elizabeth with Kern Soul News. My question today is a little bit about what Ryan just talked about, the hospitalization rates. So my question is, do you know how many days we have not been meeting that third state metric regarding the hospitalizations? And do you see us meeting that metric anytime soon, or do we expect these hospitalizations to just continue to go up?
Ryan's going to respond to your question, Elizabeth.
Thank you.
Hi, Elizabeth. So, we go in and out of these numbers with the state. Early last week, we were in full compliance with all the state metrics under all the numbers, I think Monday and Tuesday of last week. Then on Wednesday went up, our hospitalization number went up. And then over the weekend, it began trending downward, and it's even gone down lower. I don't know what the projections are for tomorrow or the next day, but again, as I said before, we will likely kind of go in and out of the various areas of these state metrics. And we're monitoring ourselves for that. The state's monitoring us for that. But on the hospitalization, most days, frankly, since the state started keeping track, and we've been keeping track under this particular metric, again, the percentage change in the 3-day average of hospitalized patients, we've been below the state's goal of 10% on most days. We happen to be above today. So that is a metric that is of concern to the state. It's certainly a concern to us here locally to make sure that we've got the capacity in our hospitals to treat patients, and we'll be continuing to watch that particular metric as we go forward.
Thank you, Ryan.
Our next outlet is Mojave Desert News. Anyone on the line? Okay. Valley Public Radio.
Hi, good morning. Can you hear me?
We can, go ahead.
Okay, great. Carrie Klein here. Yeah, so I wanted to talk more about this measure to close down bars. And so, as you folks have said, you were not necessarily seeing the data in Kern County that there have been a lot of cases associated with bar reopening. So I guess this appears to be kind of preemptive from the governor, at least when it comes to Kern County. Do you feel that it seems appropriate to be making preemptive decisions like this to close down businesses? Or should it be more, or would it be more prudent to wait for more information that, to come out of contact tracing and be more reactive instead of preemptive?
We're going to have Matt respond to your question.
Good morning. So as I stated earlier, I was told at 11 on Sunday on a conference call with the other directors of public health throughout the state, we were not consulted with this decision. It is important to note that the average number of daily cases does continue to increase. We have seen counties in California that have struggled with providing enough beds and ICU beds, from Imperial to Tulare to Kings County. They have struggled at having beds available in case there are more cases coming. So it is something to be aware of. I think we should be doing everything we can to ensure the integrity of our healthcare system. Ryan mentioned the number of beds that we have available in Kern is high. Our cases have continued to go up as the model has predicted. So I think it's wise for us to be cautious. I'm anxious for a phone call today with the state to ask those questions, to see if there's any data behind the premise that they've used in their letter, their public letter that went out today. So we're going to wait for their information, but certainly we're going to adhere to the state's requirement and ask that our local businesses do their best to adhere also. Any other questions?
Yes, thank you. I just wanted to clarify the hospital beds. So you mentioned it was 800 something hospital beds, 66 ICU beds. Are those the number of beds in total in Kern County, or just the ones that are available?
So right now, we have 810 beds available throughout our 10 acute care hospitals. And we have 66 ICU beds that are available system-wide also.
And do you happen to have the total number of beds that you have altogether?
I don't readily have it. I'm certain we can provide it to you later, though.
Okay, thank you, that's it, I appreciate it.
Our next outlet is Channel 29. Anyone on the line with questions?
Jeanette here. Can you guys hear me?
Yep, go ahead.
Hi, good morning. So what metrics did Kern County fail to meet for the state to make this decision? I know that the county is one of several counties that have been on the 14-day monitoring list, but in addition to that, did the county fail to meet metrics? And if so, which specific metrics did it fail to meet for the state to move forward with this decision?
Jeanette, we'll have Matt respond.
Jeanette, good morning. The state has a monitoring program, and it's a public website, and they have different metrics that we must meet. In order to be in compliance, we must meet them all. That's readily accessible online. It talks about cases and percent positivity and ICU beds available. If we fail to meet any one of those metrics, the state would then deem the county not in compliance on that day. As you summarized, I believe there's 15 counties that didn't meet the 3-day criteria, and then there's 7 counties that exceeded the 14-day consecutive criteria. Does that answer your question, Jeanette?
Yes, so because it exceeded the time frame, which is the 14-day criteria on that list, that's basically placed Kern County out of compliance.
Correct.
Is that correct?
Correct.
Okay, so that was my first question. Thank you so much, Matt. And then also, how will Kern County enforce, the closure of bars? I know that you mentioned there are 70 in the county that have been identified, but can you walk me through the enforcement procedures the county has considered or is considering implementing to go ahead and enforce the state's mandate?
So we have not received information from the state yet on how they are proposing to enforce this requirement. Until I receive further information, the county's position will be that we will continue to advise our local businesses on the requirement that the state has placed on us, that the need to comply, and that we are here to help them comply, to interpret these rules as they're confusing, and if there's complaints that come in or other businesses that are concerned, as we've done with every other guidance document, we would reach out to those businesses, let them know about the requirement, ask them to comply, just continue that message about the importance, because it helps not only drive down the numbers and flatten that curve, but it ensures that we are being compliant with the state's order, which is also obviously important. We have continued the messaging about being aware if you're sick and staying at home and wearing a mask or some type of face covering. We've partnered with the Kern County Hispanic Chamber of Commerce and Jay Tamsey, the executive director. We've got some new messaging that's coming out today, some PSAs and some billboards. So we are just continuing to highlight that COVID-19 is a concern for us, and we still have some work ahead of us, and we don't want to lose any progress that we've made to this point, because we've all made sacrifices and we've all made changes, and it's been working. We just need to continue the effort. Any other questions?
Thank you, Matt. Thank you, Matt. Thank you. I just need a clarification. So you mentioned that the county will continue to be advising the businesses to comply. Yesterday's press release from the state advised that those that were on the list for 14 days or more, that they would ask the bars to close immediately. So based on your response, for bars that fail to follow through with the state's mandate, will the county provide a consequence?
So right now, the state is in charge. They're the ones that are requiring these facilities to close. On the conference call yesterday, we had discussions with the state about enforcement. They did make mention that the state could enforce, and we've seen that happen locally from ABC and even Cal OSHA, our potential enforcement agencies. From the county's perspective, our role is to advise, to reinforce those orders, and we'll wait for further direction from the state. But they're the ones that are making this decision. They're the ones asking our businesses to close. We're going to do our best to encourage it, but we're going to continue to talk to the state about how they will enforce their order in the county.
Okay, so you're going to leave it up to the state to kind of follow through with the enforcement?
On the enforcement aspect of it, yes, but what we've seen locally is we've done a terrific job at heeding that advice, to listening carefully, to understanding the guidance documents, because again, they're very confusing at times, but we've seen a tremendous response from our business community and our public, and I'm certain that they'll continue, and I'm certain that we'll do well. If there's businesses that are struggling at understanding it, we'll be there. We're going to help. There were a few times, I think, in this last couple months where the state did come down and either enforced or proposed enforcement on businesses that they saw out of compliance. So my expectation is it would be the same.
Okay, perfect. And one last question. So I know that you mentioned that you guys are waiting for more guidance from the state, and sometimes it's a little confusing. What is the clarity that the county is seeking from the state?
So we want to understand the data in more detail. If we look back over the last 14 days, it appears to us that at least on one of those days, we were in compliance. So I don't have data to show 14 consecutive days of compliance. Although that is a small data discrepancy between us and the state, it's important to recognize that we've still not met the metrics most of the other days, but that is a significant distinction if you're one of those businesses that is being asked to be closed by the state. We want clarification on enforcement. We want clarification on when the state will issue the order. We want clarification on when we can remove that, the businesses from that list and allow bars to reopen. We want clarity on what is that specific criteria. We believe that we have to be off of the state's monitoring list for 14 consecutive days. We want to ensure we understand that. We also have some data issues. We've not been able to mimic the data that the state has provided to us perfectly with our epidemiologists. We want to understand that well so we can track it carefully, because as Ryan has said, there's been times that we've been just barely over. There's been times where we've been 0.1% over, and that matters significantly if you're one of these businesses that are affected. So those are some of the components that we would like answers to from the state.
Thank you, Matt.
Thank you.
Our next outlet is Channel 17. Anyone on the line?
Bob Price.
Go ahead, Bob.
I know Matt earlier said that you've not seen any significant spikes from bars, if I understand it correctly, and that households and residential settings have been the primary origin of what you've seen. But that said, have you been able to identify any particular bar or event or time frame involving a specific venue where you have had some spikes?
Bob, sorry, we're trying to figure out who's best to respond. We're going to have our lead epidemiologist, Kim Hernandez, respond. Give us just a second, okay?
Okay.
Bob, let me see if I can reiterate your question, just so Kim knows that we have it right. You're asking whether or not we've seen any single bar identified as a source or any other event or something along those lines that was a source of a major group of cases. Do I have that right?
Yes, correct.
Okay.
Yes.
Hi, Bob. As we've mentioned, we've seen a number of cases develop out of households where people in the same family or living together become positive. We have not had any giant community outbreak associated with a bar or restaurant at this time. Obviously, as we've mentioned many times, if there is a significant concern for our community for an imminent public health risk, we would immediately notify the public. And as we haven't had to do that so far, we don't have anything to report specifically about bars contributing to the number of cases.
Okay, thank you. One follow-up, if I may. We got 4th of July weekend coming up. 4th of July, in fact, I think falls on a Saturday. And that's a situation where you're going to, traditionally, you have residential gatherings. Do you have any, are you going to make any statements or offer any guidance specific to pool parties, 4th of July parties?
Bob, I think we're going to have either Matt or Kim respond. Give us 1 second to figure it out. Okay, we're going to have Kim respond.
So, we do know with the holidays coming up that people, have an opportunity to historically gather, and we want to remind people to keep their distance, particularly around something like a pool where you wouldn't be expected and it would actually be not recommended to wear a face covering while swimming. Obviously, when a face covering is wet, that can create a difficult a process of breathing, and so it is not recommended to wear a cloth face covering or a face mask while engaging in swimming or water activities. That being said, even though we know that it can be hot in Kern County, we want people to continue to keep their distance. Distancing is an important piece of limiting transmission of COVID-19.
Thank you. May I ask also how many public health employees are on this job? Full-time contact tracing, for example, seems like would be pretty time-consuming and manpower consuming. How many employees are working this deal?
You're looking for the number of total contact tracers employed through
Yes.
Kern County Public Health?
Yes.
Bob, good morning. There's approximately 90 public health employees doing contact tracing. There's probably another several dozen that are doing other administrative duties as it relates. And then there's about 10 individuals that are specifically assigned to the call center. We have about 12 more that staff our Department Operations Center. So I know that's a number of numbers at you, but it's really most of what public health has done is we've suspended a lot of our other activities so that we could focus all of our efforts just on COVID-19.
Thank you, Matt. Appreciate it.
Okay, our last outlet is KNZR. Anyone on the line?
Tony Lee, KNCR. Good morning.
Good morning.
I'm curious about some things that you've already kind of talked about, but the enforcement end of it specifically, because it appears to me, and this is from my going out and just having a look around to see what are people doing. And the bars themselves appear to be trying their best to follow the guidelines. But what I see happening is the patrons are coming in and they're just moving chairs over to the bar and sitting shoulder to shoulder. They're moving tables from the 6 feet apart to right next to another table and, gathering small groups. So my question is there any way that you can or that you plan to get to the individuals as opposed to just sending information out to the bar owners?
Tony, we're going to have Ryan respond. Hang on 1 second.
Hi. We've been talking about it for weeks and weeks now. This is really less about businesses reopening, in my opinion, and it's more about individual public health choices as it relates to COVID-19. So making good choices or not making good choices. Obviously, going into a bar, moving tables together when they're supposed to be separate is not a good individual choice. Again, we just continue to reiterate that that's the most important. We keep pushing out that, there's a suite of actions that people need to be practicing: hand washing, distancing, being vigilant, not getting into big groups of people that you're unfamiliar with, wearing a mask when you can't properly distance, certainly when you're going into a business and you've got large groups of people in there, understanding that not everybody can wear a mask, but most of us can safely. And if you can't distance, you should do so. So those are all of the things taken together that we need to continue to do as a community. And I'm not sure, the word must be out. We've talked about it enough. It's in the news every day. It's on TV every day. Just continue to use, everybody be smart and utilize these best practices that are being provided by our public health professionals.
If I may take that one step further, you are correct. The word is out and has been out for some time. But the people who are, for whatever reason, adamantly against wearing a mask and social distancing, there are some people who simply refuse to do so. And I feel that may bring it back to the enforcement question. Is there some way that, in your mind, is there anything that you may plan to do to enforce these laws or to give some penalty for not complying? Because right now people are just saying, I don't want to do it, so I'm not going to.
Okay, hang on, Tony.
I think a big motivator is that the state has just demonstrated that they're willing to come in and shut down a group of businesses in our county initially here. They could certainly do that for other businesses. And so if we want to continue to see those actions happen, then we can ignore all of the guidance that's being provided. I think, in the case of bars, and I know your comments are about individuals and, patrolling individuals, which I think is very, very difficult to do. We have a hard enough time enforcing illegal fireworks here in this community. The way this gets done, bars have been directed to close by the governor. I suspect that they will close. There's no better way to enforce that than through state regulations. They obviously have the ABC, they have Cal OSHA, they have other regulatory tethers to these bars. If I'm a bar owner, I'm closing down. I don't want to risk my alcohol license being messed with in any way. But again, to the individuals going into these establishments, please follow the guidance, follow the recommendations, follow their requests. Please heed them. Do us a favor and partner with us so that we can this is all about keeping as many businesses open as we possibly can, dealing with this virus, and again, at the end of the day, avoiding having our hospitals overwhelmed. Please, everybody, support the guidance that's been put out, and we really can't say it any more directly or any differently. Thank you.
Thank you, folks.
Okay, before we wrap up, I want to thank the Independent Living Center and Alex for being here today. They're always here to make sure that our deaf and hard of hearing community gets this information as well, so a big thank you to them. And I'll pause for a second to see if there are any outlets that have follow-up questions. Okay, that concludes our Monday COVID-19 briefing. We will see you on Thursday. Thank you.